Hi everybody, it's Dr. Novoa.
Hi everyone, it's Danielle.
Hi. We want to do this video today regarding National Cesarean Awareness Month. I've gotten a few messages to talk about it, and because a lot of people know that I am an advocate for patients not undergoing cesarean sections, but the awareness is to make people aware that when cesarean sections are necessary, that patients should not feel like there's something wrong with that, or that they're less of being a mother, less of being a woman. And so we did want to stress, first of all, that we are advocates for the patient making the proper choice once she's properly informed, and that there's nothing wrong with having a cesarean section when you need to have one. Now, from our standpoint, and Danielle can back me up on this, we get patients every single day that come in having had unnecessary cesarean sections. And unfortunately, if you want to be aware of what actually is going on, in the United States, 1 out of 3 patients will undergo a cesarean section, and half of those cesarean sections will be unnecessary.
The main reason we get is because the doctor is a holiday, or it's the doctor's birthday week, or usually it's because it's a holiday, and the patients tell me it's a holiday, and they didn't want to have to sit on the patient laboring for 24 hours or more, so they just decided to do C-section. When there is nothing wrong with the way the patient was progressing in her labor. So that's the main reason I get actually from the patients.
And basically that's completely unethical, but that happens every single day, and the reason that it's happening is because there is no accountability. A doctor can have a 90% cesarean section rate, and there's nothing that's going to be done about that. And for us, that we're trying to advocate for cesarean section rates under the recommended number, which is around 15%, we just are basically told, you know what, don't rock the boat. You know, we don't embarrass our colleagues, don't embarrass the other doctors. And basically, it's not about the doctors, it's about the patients. So for the ladies that have been told, hey, listen, the fetal heart tracing didn't look good, or my baby's heart rate was going down, things like that, yes, in a number of times that is correct, that is the proper diagnosis on why you needed a cesarean section. But we're calculating 90% of the time that's not the real reason why you're having a C-section. Failure to progress, failure to dilate, oh, I only got to 5 centimeters. In reality, if you give the patient a little bit more time, they're more likely than not to be able to deliver vaginally. And unfortunately, for all of those things that we're saying, you become a high-risk patient for your next pregnancy, and probably are going to be told that, most likely that you're going to be told that you need to have another cesarean section, which absolutely is not true. The vast majority of women that have had a cesarean section are great candidates, or at least very good candidates, for a vaginal delivery. So if you've been told that either you can't have a vaginal delivery after a cesarean section, or the doctor says that he won't do a vaginal delivery after a cesarean section, please get more information, because there are plenty of us that do VBACs, and if not, the University Hospital does VBACs. So amongst that big awareness that we want to stress to patients is that, yes, there's nothing wrong with having a cesarean section for the right reasons, and if you have a cesarean section, no one's going to be should feel stigmatized, and that there was a failure there. But at the same time, we don't want patients having to undergo unnecessary cesarean sections, when in reality here there's no accountability, and greater than 50% of the time patients are having cesarean sections which are completely unnecessary. So get the take-home message: get as much information about having a vaginal delivery as compared to a cesarean section. If you've already had one, get as much information as you can about a vaginal birth after cesarean section or a VBAC. And just be aware, be informed. That's what we're really important, or what we feel is really important on this particular subject. Okay? Thank you very much for listening to us.
Bye.
Bye.